The entire area is covered with a resorbable membrane to again prevent gum tissue ingrowth. New patient bone will then fill all the voids and replace the artificial bone. In about 7 months, 70% of the bone placed could be replaced with the patient's own new bone. The membrane will fold over itself as it is being lifted, creating a barrier as well as covering small perforations. In this situation, we still have enough bone left in the ridge to stabilize an implant, and so we can place the implants at the same time as the grafting procedure. The space created is then filled in with different bone substitutes selected by the dentist. This can be the patient's own bone or an allograft. The window access can be covered with a membrane to aid in healing and the flap repositioned. After the teeth have been removed, the body has no need for the bone ridge, and the area will atrophy, just like unused muscle. This may create insufficient bone to place implants in the future without grafting. As well as any bone defects. These areas can be covered with a resorbable membrane to further aid in the healing process. The flap is then repositioned and allowed to heal. The sutures will be removed or will dissolve if self-dissolving sutures are placed. With time, the membrane underneath the gums will dissolve and the bone substitute will be replaced with the patient's own bone by the body. This treatment will often create an ideal bone ridge in the edentulous area. This movie shows an impacted wisdom tooth that causes inflammation. Since there is not enough room in the mouth for full eruption, the gum tissue covers part of the tooth and is raised. In addition to inflammation from food impaction in the pocketing, this tissue may be traumatized by the upper tooth. It can swell and cause great pain. Treatment starts with antibiotics and getting the tissues to settle down, followed by the extraction of the wisdom tooth. Once the tooth is gone, the gums recede. Since the tooth is completely covered with bone, significant bone is removed to gain access to the tooth. Then we section the tooth. The tooth sections can then be removed with elevators. A bone substitute can be placed in the socket to aid in healing. The flap is repositioned and sutured into place. The sutures dissolve and the area heals. The bone is then carefully removed until the impacted tooth is exposed. We then attach an orthodontic button and a loop to the impacted tooth. An elastic or gold chain can be used to create the force needed to move the tooth into place. The tissues around the impacted tooth heal and distort as the impacted tooth moves towards its final position. First, braces are placed to move the teeth into the positions required. Then the mandible or bottom jaw is cut at an angle. It is then moved forward to the desired position. The jaw is then secured in place by bone screws. The braces keep the jaw in place and can be further adjusted to make any refining movements to finish the treatment. The jaw heals by filling in the voids and fusing the cut sections together.